Victorian Premier Daniel Andrews says the rate of community transmission of coronavirus in the state is of growing concern, with 49 mystery cases detected in recent days. 3 more people have died from COVID-19 in Victoria in the past 24 hours, and there have been 397 new cases. Reporter Yvette Gray is in Melbourne. So Yvette, just take us through all the detail with those latest numbers today.
Good afternoon. Well, while we have seen a drop in cases compared to the past 2 days, the numbers are still extremely high and concerning. So just taking you through those cases, as you mentioned, 397 new cases in the past 24 hours. We've had 3 deaths. That's a man in his 80s, a woman in her 80s and a woman in her 90s, bringing the total death toll for the state to 116. Now, we have almost 6,000 active cases currently right across the state. We have 379 people who are in hospital, including 41 people in intensive care, and we're told that 24 people are on ventilators. Now, we also have an increase in our healthcare workers who have been infected. That number is now at 1,075. Same with our aged care cases, active cases linked to aged care. That's now at 1,008. So the Victorian Premier, Daniel Andrews, has said that he's particularly concerned about community transmission, and in particular these 49 mystery cases, as he calls them, which is basically where they just can't find the source of the case, and he fears this number could be even higher. This is what he had to say a short time ago.
There's an additional 49 cases, mystery cases, 49 cases where we simply cannot track back what the index case is, what's the zero case, where did it start, where did those people get it from. You can't be certain, of course, if there's that many that you don't know how they got it, you can't be certain that there isn't even further community transmission, even more mystery cases out there. That is, in some respects, our biggest challenge.
Now, he did not have any further announcements today in terms of restrictions or additional lockdowns, but he did say once again that he is waiting for the results of a detailed analysis of our data that is currently being undertaken by both state and national healthcare workers to determine, I guess, what the trends are and what needs to be targeted. And he said that once he gets those figures, he'll be able to decide what further steps need to be taken.
And Yvette, while we still have those concerns, particularly around community transmission, we are still seeing people in Victoria who are breaking the rules.
That's right. So the Victoria Police have in the past 24 hours issued 168 fines for people breaching the restrictions. These included 18 that were issued at vehicle checkpoints, and some recent examples of bad behaviour include someone who was caught driving from Melbourne to Wodonga, which is in northeast Victoria, some 3 hours away, to buy a Big Mac. So he or she would have copped a $1,600 fine for that. Also, 10 people having a party in an Airbnb. They were caught in the city, and apparently 2 people at that party were hiding in a bedroom when police arrived. And to date, around 270 people have now been fined for not wearing their mask when they leave their home. So the Premier once again today pleading with people to do the right thing. He says the only way that we can put a stop to this spread of the virus is if people do follow the rules and the restrictions.
Our reporter Yvette Gray there in Melbourne. Well, let's now turn to Queensland, where 1 new case of coronavirus has been reported in an aged care worker in Pinjarra Hills. Dee Clark joins us now from Brisbane. So Dee, what can you tell us about this latest case there in Queensland?
Well, this case relates to the trio of women who returned from Melbourne, allegedly flouting those rules around quarantining if you're coming back from Melbourne. Yesterday we heard from the Chief Health Officer that a 27-year-old man had tested positive, and he had been dining at a Korean restaurant where one of those women had been eating at. And they were at an adjacent table. Now, his wife has tested positive. The bad news about that is that she works at an aged care facility, which had already been placed into lockdown yesterday, but today Jeanette Young confirmed that, that his wife had tested positive.
So 1 new case overnight. And we're going to expect that over the next few days. So this lady is the wife of the gentleman that we confirmed the day before. She works in that Bolton Clark facility at Pinjarra Hills, and they've done the most amazing job. Now, we do think that it was possible that she was infectious when she worked her last shift at that facility, so we are going to continue to have that facility in lockdown.
There are 105 staff that work at that, residents at that facility, and 150 staff. They are all going to be tested. There's also a concern that some of the staff may have be working across different nursing homes. So there's a massive contract tracing operation underway, but Jeanette Young is very happy with how the residents of that facility are being treated. They all have separate rooms and separate bathrooms, so she says that they couldn't be in a better position. But she says if any of the elderly residents do test positive to coronavirus, they will be evacuated to hospital.
And Daya, can I just check with you as well? We have had the border closed to people from Greater Sydney into Queensland overnight. Has the dust settled somewhat since the rush that was made at the border regions there?
Yeah, there was a big rush late yesterday with the airlines putting on extra flights to get people back into Queensland. That has eased somewhat. Apparently, at the border on the Gold Coast, things are flowing quite well now. But yesterday there were long lines and long waits to get back into the state.
Our reporter Daya Clark there with the latest from Brisbane. Well, to New South Wales now, an 83-year-old man who had COVID-19 linked to the Crossroads Hotel cluster has died. There have been 57 cases connected to the hotel in Sydney's southwest, one of a number of hotspots identified across Greater Sydney. Other hotspots include Harpoon and Hotel Harry in Surrey Hills, the Mounties Club in Mount Pritchard and Harris Farm Markets in Leichhardt. The New South Wales Department of Health has announced 17 new cases in Sydney overnight.
Of the 17 new cases, 3 cases were in travellers in hotel quarantine. 1 case is a New South Wales resident who returned from Victoria. 2 cases attended the Apollo restaurant. 2 cases attended the Mounties Club in Mount Pritchard. 6 cases are contacts of known cases. 1 case is locally acquired with no known source.
The Northern Territory has recorded its second confirmed case of coronavirus in 2 days. The woman is the partner of a man who tested positive to COVID-19 yesterday while on a flight to Darwin from Melbourne. They had approval to travel to Victoria because a member of their family needed essential medical treatment. They're receiving care under isolation at Royal Darwin Hospital, and the NT government says contact tracing has been completed.